Symptoms of long COVID include chronic fatigue, difficulty breathing, hair loss, brain fog, memory lapse, depression, anxiety, changes in taste and smell, and even muscle or joint pain. Hi everyone, my name is Emily. I'm one of the pharmacists here at MD Custom RX. With COVID on the rise again, we wanted to do a video about something called long-haul COVID and discuss how prescription compounding can be a crucial step on the road to recovery. We all know what COVID is by now. The typical fever, chills, shortness of breath, muscle aches, but have you heard of long-haul COVID? Long COVID is something that's causing ongoing health conditions, and this can last for weeks, months, or even years. It is defined as symptoms that cannot be explained by an alternative diagnosis and last at least 2 months following the initial infection. It's suspected that after month 3 of these symptoms, that long-haul COVID is at play. Symptoms of long COVID include chronic fatigue, difficulty breathing, hair loss, brain fog, memory lapse, depression, anxiety, changes in taste and smell, and even muscle or joint pain. COVID causes a whole lot of problems in the body. The number one result of COVID is inflammation. Inflammation is responsible for all sorts of things negative in the body, such as pain, difficulty breathing, brain fog, mood and behavior changes, can affect everything from the brain to the lungs, the heart, and the eyes. There have also been links between high inflammation and Alzheimer's, as well as cancer, heart disease, and even diabetes. When coronavirus attacks the lungs, it can attack the ACE2-rich cells that line the air sacs in the lungs, and when this happens, then the immune system will try to neutralize these virus-infected cells, and that process can actually overcrowd those already weakened air sacs and diminish oxygen levels, and that can cause things like coughing, fevers, and other breathing issues. The immune system plays an important role in defending the body against viruses and bacteria, but it can also harm the body when overreacting to prevent infection. Many of the most severe cases of COVID are a result of just overreaction from the body's immune system, and this is called a cytokine storm. Cytokine storm is basically a hyperinflammatory response to the virus. During a cytokine storm, immune cells can attack healthy tissues, which can cause blood clots and drops in blood pressure and even organ failure. With prescription compounding, we're able to compound medications that can really help decrease the lasting effects of COVID. One of the most popular things that we compound here at the pharmacy for inflammation is low-dose naltrexone. We have a lot of videos on our YouTube channel about low-dose naltrexone, so I won't get too far into the mechanism of that. Naltrexone is a great option to decrease inflammation associated with long-haul COVID. At traditional doses of 50 milligrams, it is an opioid antagonist and can be used for opioid relapse and also preventing alcoholism. But at doses between 1 and 5 milligrams, it actually has analgesic and anti-inflammatory effects. In a study published in 2020 discussing low-dose naltrexone as a treatment option for COVID, authors suggest that low-dose naltrexone diminishes the lipopolysaccharide cytokine storm and can also interact with the spike protein binding. They also noted that unlike at doses of 50 milligrams, low doses of naltrexone between 1 and 5 milligrams are said to release beta endorphins and also reduce the serum levels of pro-inflammatory cytokines. These factors suggest that low-dose naltrexone can have a significant role in alleviating these symptoms of acute and long-haul COVID. We compound naltrexone as tablets, capsules, and even suspensions. For other complications associated with long-haul COVID, such as memory lapse and brain fog, we can also compound for that too. Dr. Dane, one of the other pharmacists that works here, he's actually recently done some great videos on 2 agents that would actually be really beneficial in those situations. That would be methylene blue and also red ginseng extract. So I strongly encourage you to check out those videos. Can definitely be helpful with those cognitive blocks associated with long haul COVID and even acute COVID. COVID can also cause hair loss. Sometimes this can be a very brief issue lasting only during the acute infection and sometimes a little bit shortly after, but for others it's more of a long-term issue. We compound with several agents for hair loss, and we can make things such as foams, solutions, serums, even capsules. There's also a test that we have access to called the Tricho test. It looks at your genetics and your DNA to determine which of these agents would work best for you based on your DNA. So that's awesome because there's a ton of different agents that we can use. So when we get those results in, then we're seeing what medications would truly work for you and have more of a targeted approach rather than just guessing. Long COVID is a common issue for many people today. And although there are not a lot of options for patients, prescription compounding can definitely fill a gap in care. If you found value in today's video, please feel free to like it, share it with a friend, subscribe to our channel. We've been putting out a lot of educational videos lately, so look forward to that. If you are interested, we do offer one-on-one consultations with a pharmacist, so you can give us a call to schedule that. If you have any other questions, please feel free to comment on the video below. Otherwise, thank you for watching, and I hope you have a great day.